Sign and symptoms of gonorrhea. Gonorrhea is an infectious disease which is transmitted through the infected intercourse. Initially, it is asymptomatic in both genders, but later on, when the severity of the disease exceeds, then it produces symptoms in both the genders. In men, there is urethritis, due to which there is dysuria. The urination is obstructed and is very painful. Urethral discharge, which is initially white, then later on it turns into yellow and greenish one, and it is very bad smelled secretion or the discharge. When the infection is ascending one, then other symptoms are produced, that is prostatitis, and also there is epididymoorchitis, that is the sperm carrying ducts, they are inflamed, obstructed, which may later produce infertility in men. There is swelling, tenderness of the scrotal area, testicles, which is a very harmful and painful pathology. In females, there is pain, lower abdomen, and in pelvic area, vaginal discharge, foul smelling, coloring from white to pale and greenish one, due to cervicitis, excessive amount of blood loss during menses, intermenstrual period bleeding is also noticed, which is abnormal one, in addition to the normal menstrual period. Then there is pelvic inflammatory diseases producing pelvic pain. When the infection is ascending, it also involves the fallopian tubes, uterus, endometritis, and there is obstruction in the passage of the sperm upwards within the fallopian tubes, causing the more chances of infertility, painful intercourse, bleeding during the intercourse. So these are the symptoms of the genital manifestation. Non-genital or extragenital manifestations, that is when there is infection of the rectum due to anal intercourse, there is proctitis, rectal discharge, rectal bleeding, painful defecations, swelling around the anus, which is very painful and troublesome. When the infection is in the oral cavity, there is pharyngitis, sore throat, dry cough, difficulty in swallowing. This is due to the action of the gonococci during oral intercourse. In addition, when the infected secretions and the discharge is touched by the hands, and then it approaches to the eyes and the near the mouth. Then there is infection of the pharynx and the eyes due to the traveling of the excess of the bacteria in these organs. So there is inflammation of the conjunctiva, redness, painful, and the mucopurulent discharge from the eyes. Similarly, in the newborns, when they get infection from the infected mother during vaginal delivery, there is a condition or pathology called as ophthalmia neonatorum, that is the neonatal conjunctivitis due to this infection. So the symptoms are according to the method of or the process of intercourse. If it is vaginal, whether it is anal, whether it is oral. So these are the various types of intercourse producing the accordingly symptoms in the patient.